COVID-19 infections are continuing to circulate nationwide, with at least 29 states reporting high or very high wastewater levels. According to the CDC, updated COVID-19 vaccines are largely available, just as sweeping federal policy changes have shifted away from broad recommendations to encouraging people who want one to consult with a healthcare provider, creating widespread confusion about vaccine access and recommendations. So here with critical information to help you navigate these changes and protect yourself and loved ones is former U.S. Surgeon General Dr. Jerome Adams. Hi, Dr. Adams. Thanks for joining us this morning.
Good to be with you.
Okay, so ACIP just changed their COVID-19 vaccine recommendations. Can you help clarify what Americans need to know?
Well, the big change is that instead of recommending COVID-19 vaccines for all adults, which was the previous policy, ACIP now advises what's called shared clinical decision making. What this means is that it's up to patients and their healthcare providers to decide together, based on their individual risk, whether or not someone should get a COVID-19 vaccine. And it's why it's more important than ever to have an open conversation with your healthcare provider so that you understand your risk.
Okay, that's really good, because there's a concern that people may now need a prescription to get a COVID-19 vaccine. Is this true? And what does that mean for Americans that are trying to stay protected?
Well, sadly, the answer is it depends, and we don't know, and that's part of the problem. ACIP did not recommend requiring prescriptions, but because of unclear federal guidance in this patchwork of state rules and laws, whether or not you can get a vaccine without a prescription varies by age, insurance, state, even which pharmacy you visit. If you're 65 or older, or you have an underlying condition, you should still be able to get vaccinated without a prescription in most places in the United States. But for younger or lower risk groups, the process may be harder, and that's especially concerning for the 26 million uninsured Americans who don't have a regular doctor.
You brought up insurance. So what do these changes mean for insurance coverage? Will people still be able to get vaccinated without out-of-pocket costs?
The good news is that major private insurers committed to covering all ACIP recommended vaccines, including the COVID-19 vaccine. That covers about 315 million Americans. Public programs like Medicare, Medicaid, and the Affordable Care Act marketplace will continue covering COVID-19 vaccines as well. But again, 26 million Americans who are uninsured don't have access to a regular doctor, and I'm hoping state and federal programs will step in.
Okay, if people are wanting to really just, get some guidance and really understand and want to stay protected in the area, where should they go to get more information and really dive in?
Well, understand if you're over 65, you have a 24 times chance of actually ending up hospitalized if you get COVID. If you're pregnant, higher risk. If you have comorbidities, high blood pressure, diabetes, overweight, you're at higher risk. So most adults actually in the United States fall into a higher risk category. But start by talking to your doctor or your pharmacist. They know you, they know your local options. You can also go to cveep.org, and they have information not just about the COVID-19 vaccine, but about all other vaccines. Or contact your state or local health department for the most up-to-date local guidance.
Dr. Jerome Adams, I appreciate the conversation, and thanks for making it nice and clearly cut. So we appreciate you.
Hey, thank you so much for having me.